Winter has come. I see a lot of patients with fever, cough, running nose, pneumonias. What is happening? What will happen? So how we can avoid all these things? How to keep ourselves safe from infections coming in winter? What happens in winter? In winter, the temperatures come down. So there is a possibility that viruses, bacteria, all these will thrive better because heat will kill germs, but cold will make them grow better. So when they grow better, so they will infect us because this is a holiday season, cold season, people are going out, roaming around in malls. All these things can be difficult for certain population. There are different types of infections which come, which can be simple and sometimes it can turn very deadly and life-threatening. Simple infections like routine flu can come down in 5 days. But if this flu is not taken care very well or your immunity is down, then it can turn to pneumonia, which can turn to a deadly disease and patient can also lose their life. So to avoid this, what should we do? A simple flu, if it is not recovered in few days, come and meet your physician. Do appropriate investigations and tackle the infections appropriately. If it is a bacterial infection, take antibiotics. Viral infection, for some viral infections we give viral antivirals. For some it will resolve on itself. And also you have to have a good eye to see if these patients can turn into deadly infection or they recover fast. So that can be done by your physician by assessing. So if you need admission, physician will tell you to get admitted so that you will not land up in ICU, because if you neglect it, we may lose life. So fundamentally, look about these things. One is cold turning into pneumonia, influenza turning into pneumonia, a routine RSV infection, respiratory syncytial virus infection which coming to pneumonia and going to sepsis, or we see resurgence of COVID in this season. This also can cause severe infections. And other than that, patients who are already having bronchial asthma can get infections fast, and patients with COPD, that is chronic obstructive pulmonary diseases like bronchitis and emphysema, these patients tend to get more infections in this season. So we have to be very careful. Avoid going into closed groups or busy places. If you need to go, then try to put your mask so that you will not have infections from others. And being a lot of people in closed areas in AC rooms, one of us have cough and cold, it can transmit to other people. So what we need to do for this winter? Be safe, avoid touching all the objects, keep your hand hygiene well, wear mask, and elderly people, when you go out, compulsory wear mask, and also children. So by doing all these preventive actions, you may not land up in hospital admissions. Probably you may get mild infection which can be treated at home, but if you ignore it, you will land up in a severe infection and land up in hospital with a severe consequence. So to avoid it, prevention is always better. Prevent these diseases in winter and stay safe, stay healthy.
Like, comment, and subscribe for more health updates.